Hi everyone, I'm Carrie Jacquet, VP of Marketing at SenSage, and I'm here for another 5 Minutes with Joe Gottlieb, our CEO and President. And today we're going to be talking about a recent report that was done by the Ponemon Institute, and it's all around meaningful use and HIPAA high-tech and healthcare issues that providers are facing. So let's talk about the report and what you found interesting about it.
Well, it's an interesting update on statistics of what's happening in the healthcare industry. We all know that meaningful use is driving a lot of investment in electronic health record systems. There's been a big, as part of the 2009 Recovery Act, we put a lot of money up that could be gained by healthcare organizations that are adopting electronic health record systems, really to drive more effective practices in medical scenarios where we're trying to improve outcomes, we're trying to leverage patient data to better understand what's going on and the like. So it's a great driver for that.
But wait, what's meaningful use? Let's
so
start with that.
Meaningful use, the clause is, that's got a lot of attention, is that you have to put these systems to meaningful use. You can't just adopt them and not leverage them for more effective medical care. So that there's a standard there that has to be met to be able to get the incentives, which I believe in the next year the payments could total something like $24 billion. I mean, so huge amounts of budget on the line for healthcare organizations that have traditionally been strapped for cash to drive a profit and to be able to continue to invest in their infrastructure. So a lot of attention is placed on getting these incentives into the organization. And some have pointed out that has almost counterintuitively, that has driven adoption of more systems without adequate security. So part of HIPAA and high-tech is about making sure that you're protecting electronic patient health information and these records. And there are, with high-tech now, there are more specific and severe penalties and mandates associated with protecting this data. In particular, if you have a breach that affects more than 500 patient records, you have to notify
disclosures,
the Health and Human Services and go through the disclosure scenarios, and you can be subject to fines up to $1.5 million directly just for having the breach, let alone downstream costs of giving people credit monitoring services and the like. So sort of a very turbulent situation here in which there's a lot of incentives for typically cash-strapped organizations, and there's yet higher bars for protecting the information
and greater risk that they're going to be out of compliance in some way. I think even the potential rules that'll be put in place around accounting of disclosures that says, if that goes through, that a patient will have the right to find out who has accessed their records, whether it be their pharmaceutical records, their financial statements, any of those things over an 18-month period. And so you're right, suddenly all of these disparate systems that are out there are going to have to start getting organized in some way.
Yeah, I mean, it's a kind of a crazy environment for healthcare organizations that, let's be frank, have not been leaders in IT. And one of the key statistics is that some place it as low as 2% of revenue spent on IT in the healthcare industry, compared to up to 10% for some of the more advanced verticals like financial services that have always been big investors in IT. And so you have this happening in a vertical where there hasn't been a lot of money, and there hasn't been, therefore, without a lot of money, a lot of investment in competencies and staff and infrastructure, etc.
Right.
Meanwhile, there's some other interesting statistics, right, where you have a rapid adoption of mobile devices by doctors and nurses, physicians, other healthcare practitioners, where they generally wield more power to dictate IT policy because of the traditional roles that they play inside these vertical environments and in these business scenarios. And yet we identify that, healthcare organizations identify that lost or stolen mobile devices is one of the key risks that is driving breaches. In fact, there's even statistics that are suggesting there's a linkage between lost or stolen devices. Other thing to point out is that there's a safe harbor in all these regulations that'll allow for encryption to prevent notification of a breach. So if the device that's lost, let's say, is encrypted, and you can point out that it's encrypted, you actually don't have to disclose that particular breach. So that's another factor in here. And that's driven up the adoption of encryption across many healthcare organizations, and we believe will continue to do so. You do have to be able to point out, though, that devices are encrypted. So back to what we do, it's key that people can actually identify and log encryption events as well as data access events on these mobile devices that are encrypted or not encrypted, so that if you do have a breach, you can isolate how many records truly were breached in a situation where we know that they're not protected
right,
by
exposed.
encryption.
Yep,
Exposed
yep,
would be
yep,
a good
yep. And
term
I think that is something we're hearing more and more from our customers through our partner Cerner about. I think, do you want to describe a little bit about our relationship with Cerner and sort of how they, how they play into this? Yeah.
For sure. So Cerner's been a great partner of ours for over 5 years now. We embed our technology into their Millennium healthcare IT platform that allows it to audit for all sort of clinical access events and therefore really comply with all the audit and compliance requirements that HIPAA and high tech have to impose on these sorts of organizations. So we continue to work with Cerner to drive more deeply into those organizations in terms of bringing our capability across the entire enterprise.
Cohesion,
so it
yeah.
can address the log and event monitoring and auditing and reporting for the entire healthcare enterprise infrastructure.
Mm-hmm.
And we believe we can also help these organizations cope with the challenges presented by meaningful use as they get incented by a lot of these adoption scenarios, but also need to make sure that they're protecting the patient records and their practices accordingly. So to the report quickly.
Yes.
So a couple of interesting data points here. So data
7
breach,
minutes with Joe.
Data breach frequency at U.S. healthcare providers has increased 32% over the last year, costing the industry an estimated $6.5 billion.
Billion.
So breaches are on the rise, driving lots of costs, right? So you really want to avoid these breaches. And yet 53% said that inadequate funding is the biggest barrier to preventing data breaches. So that goes back to this long history of not being able to invest in IT,
right,
let alone security, right, which is often a trailing investment. 81% said they use mobile devices to collect, store, and transmit patient data records. Yet 49% admit they do nothing to protect these devices. Not only not encryption, but other corrective measures
right.
or
endpoint protection of any sort, right?
Or compensating controls.
EMM,
that's right. And as noted on HHS.gov, 373 reported breaches over the last 2 years, impacting almost 18 million individuals. So breaches are on the rise. There are a number of cases that are investigating also continues to rise year over year,
right,
including those cases that are found to require corrective action. So what we have here is a situation in the healthcare industry where regulations have been increased, scrutiny has been increased, the level of exposure and level of awareness is up, and therefore the real costs are certainly up, and
yeah,
yet practices are not yet tracking with the necessity of some of these drivers.
I think one of the things that Cerner has brought up a couple of times is that the folks that they're working with don't always know that sometimes the technologies they do have in place could be doing double duty. So it's very much contained to this solution will solve this problem. And I think one of the things we bring to the table for Cerner is we can work with you on your clinical and non-clinical data. If it's in the provider, infrastructure or provider landscape, we can help manage that event data, right? So,
that's right. As we say in the general case, but I would say given these conditions, even more so in healthcare, we have to be efficient and effective with our limited spending that we have available.
right,
Therefore, we should be monitoring our infrastructure, understanding what's going on, meeting with various stakeholder groups inside these organizations, not just security, not just IT,
right,
but the lines of business that have in this
compliance
vertical
guys,
a lot of influence, including
yeah,
the lead doctors that are part of their IT, SWAT teams to sort of drive the infrastructure forward. And we should continuously iterate this measurement and discussion and adjustment so that we can leverage these finite dollars more effectively and not just check the box for compliance, even though that's really critical
right,
in the healthcare industry, but really advance our security practices based upon this awareness and this measurement discipline so that we can be more effective and truly reduce the risk of these breaches, which are going to cost these healthcare organizations more and more money over time.
right. Okay, and let's just close with a really important topic, which is, did you ever watch General Hospital?
I think my mom did.
Ouch. Ouch. Because I still think about Dr. Noah Drake, and that would be Rick Springfield, to those of you who didn't watch General Hospital. But that, I'm sure that they would have been far more advanced on their IT practices.
Think of Dr. Drake paying $1.5 million for a big customer.
Ouch. I don't know, but Jesse's Girl was a big hit. He probably could have afforded
that. He made more money in a different industry.
Anyway, thanks so much for that recap, and thank you for tuning in to another 5 Minutes with Joe, give or take.